Good afternoon, everyone. We'll go ahead and get started. We may have some more joining us. We did announce it, and we understand a lot of people are just coming out of the CSD meeting, so that's always extremely difficult. But I want to make sure we have plenty of time to go through this brief presentation, and then really give us the chance to kind of open up for conversation and some Q&A. I want to ensure that we have plenty of time for folks to really talk about their direct services, their direct data, and what information they have, so that hopefully I can answer any questions, or definitely look at how I can get you answers at some point. So what we're talking about today is data analysis with agency data. It is a part of the ROMA, so if you're looking to mark off that you went to a roaming training today, this is a deep dive into our results-oriented management and accountability and our performance management structure, and how we do part of that. Many of you are obviously, aware of what you're attempting to do right now. I would assume all our agencies are right in the middle of their comprehensive community and strengths needs assessment, or they're wrapping that piece up and starting to move into their strategic plan. And when we talk about data analysis, this is exactly what a piece of that comprehensive assessment. And our goal is to give you the tools that you need to be able to expand into exactly what we mean when we talk about analyzing agency data. There's a lot of misconceptions out there when we talk about, ROMA Next Generation, or analyzing our own data and understanding what we're trying to achieve and what our outcomes may be. So we want to be very, very specific into this area. And as you're in the process of your comprehensive assessment, that you do have this tool to use as well. So when we look at the complete community needs assessment, or community strengths and needs assessment, there's a lot of different areas, right? We obviously start in, we look at the community assets, what is out there, what are our partnerships, both formal and informal, what resources are out there. One of the things that we constantly talk about is that community action can't be everything to everybody. We have to rely on partners in establishing what those are and where they're at and how those processes go. We'll talk a little bit about that towards the end, and how you can use agency data to help strengthen those partnerships, maybe also how to forego some of those partnerships. One of the things we talk about is all partnerships necessarily aren't successful partnerships, and especially when you're trying to achieve certain services or certain outcomes. And so this gives you the opportunity to be able to measure them as well. We'll open up that conversation. The other part that we're all pretty familiar with as well is looking at our community needs, and we're going to talk a little bit about how this fits into that. But overall, primarily today's discussion is going to be about those community needs and how we get into that quantitative portion of our own data. But also at the same time, it's going to include this other whole section, which is the agency evaluation, both internal and external. And around, how do we make sure that we're constantly evaluating the success of our agency or the success of our processes? So I want to jump right in, just kind of narrowing down what we mean when we talk about quantitative. Well, the first part of understanding our data is really diving into these different areas. Our agencies and majority of community action agencies are very good at the qualitative part and understanding when they pass out. Many times we hear, needs assessment. People mean the needs assessment survey. So we're really good at surveying the folks that we work with to understand not necessarily what they need, but what they want. And that's a big part of establishing the identity of our agencies and who they are, and what the people that we serve and the people that represent us actually want to see our agency deliver. And so that's a big part of our needs assessment, a big part of our community action plans. But also we look at the secondary part of quantitative, and we all do that pretty well. And thankfully, we have a lot of mechanisms in place to be able to go out and understand demographic data of our counties or our service area, our communities, but also to understand, looking at census data and what that tells us about who we should serve, who are the people in poverty, who are the folks that are in our communities overall. And we do a really good job of being able to pull down that information. And that's not necessarily the part we're going to talk about. What we're focusing in today is really that primary quantitative data, which is the customer research using agency intake and assessment forms and stored in our data system. And as mentioned previously, we'll talk about our agency evaluation overall. So just to kind of lay the groundwork and the framework for what we're discussing today, a lot of our agencies historically have measured things like their outputs. So a lot of our agencies, when I mentioned, are you using your data to understand what you can be doing in your strategic plan? Many times people come back and say, yes, we understand that we serve 100,000 people in our food bank, or that we have, 200 people that go through a training class, or we put X amount of people in these folks. And that's a big thing to know. It's a big thing to use in the community action plan, to understand, to be able to explain, why this is still a need. We can't necessarily always cut off all our outputs. But when we're talking about data analysis, we're going to really move into the next step and to understand, how do we know when we're actually effective? So we're looking at taking that next step in this discussion. So why is researching services provided by our agencies not enough? Because the question is, do we know if we're effective in what we do and what we're able to reach? And so are we successful in producing a desired or intended result? When we lay out our community action plans and we lay out our annual reports, we talk about targets a lot, what we're actually really trying to achieve, what we say we can be able to do. So again, measuring services are extremely important because they do continue to show a need. And we use that quite a bit in our ability to talk to elected officials and other funders about why there's a need for different services. But what we want to do is take that next step today and understand why those services are needed for us to actually be effective. So moving on, the way we're going to look through that is really understand our systems outcome data and what happened and to whom. So when we look at different data in our systems, we want to be able to really understand what actually happened and who did that happen to. Now, a lot of conversations we have are, we don't necessarily have the data system in place, and we're going to talk a little bit about that and how you overcome that hurdle, or we may not have systems in place that necessarily, give us the opportunity to understand all that. A couple of things that we already know that everybody does is, first of all, everybody submits an annual report, and we'll jump into that in a little bit. So in that process, that means you do have data. You do have information on the families that we serve. And so we're going to really tackle and make sure that we understand how and what the actual process is of using data that we already have. Again, we don't want to put any more processes of collecting data onto our plates, because we know everybody here is probably saying, I just can't collect any more information. And that's not what we're talking about today. But one things that are really important for us to understand is overall is the number of people the agency serves, the number of people achieving outcomes, the number of customer services from different geographical areas, and identified who achieved versus who did not. So that's exactly what we're going to talk about, and using that data and what do we specifically mean. And so we want to go through this today, talk about the model of what we're trying to say, and then give you guys an opportunity to talk about any specific programs that you have as well. So how do we do that? How do we understand? Well, the first thing is we have to really kind of peel back the onion on our processes and how that goes. So no matter what your agency is, whether your agency delivers direct services or you subcontract that out to other individuals to deliver those direct services, typically people have a process, right? You have a process of accepting folks that you eventually try to reach to. And whether that's directly through CSBG funding or some of the other programs that you operate, or it's just other opportunities that you offer in general. The big thing is, remember that everybody, our biggest, output is working with families of low income on a constant basis. So let's talk about that and what does that really mean? Because a lot of times we get caught up in the idea of, well, you want me to go out and do a research project to understand data. You want me to do a full study, and that's not the truth. What we're talking about is where is the data and what data, what opportunity we have. Well, the first thing is making sure that we have a process. And a lot of folks' processes probably look something similar to that. The first thing you'll see is you have some sort of encounter with someone, and you typically schedule an appointment for them. Well, every point of encounter, every point of contact is an opportunity to collect data. So one of the things that is really interesting is anytime anybody comes in, you have to gather that first basic information, right? Everybody has an intake process. There's demographics that are collected at that initial point of encounter. And that's really, really important that we understand that that is a point of collecting information. Every time we have an encounter is an opportunity to collect information. So that's the first point to understand, is to think, what all points of contact do I have with the families that we serve or the projects that we do? Anytime I have an encounter is a chance to get information, and that's extremely important. Then the process is understanding what type of services do we give, and what is the process and how are we analyzing? So for us, I've always typically broken down our families that we serve into two processes, which are able to work and unable to work. So let's talk about what data. What data are you mentioning that we should be able to study? Well, the first thing is what are the needs of our family? And again, remember, this is not looking at demographic data or needs data of what the census says. What is the actual needs of the families when they come in? Now, everybody has a different process, and we're going to talk about how to expand that possible process to get more information. So many of our agencies, they're emergency services in the encounter. So when someone presents to our office, the need may be that they lack the opportunity to purchase food. And so we're providing them a direct service to what that food is. But what that is opportunity to understand data. So as those folks are coming in, we want to understand all the needs that they possibly have. And we want to be able to understand how we collect that with our agency and all the information that we can possibly have. So let me give you an example of that. So if you have an agency that has a very large food bank and 100,000 people are showing up at your agency on a yearly basis with a need of food, that's information to understand. But what the question is what are all the needs of them? And do we have a current process in place that we understand at the same time that they need food, they're also needing housing, they're needing childcare, they're needing education, they're needing transportation services. Maybe they don't have access to healthcare. Do we currently have a process that analyzes that? And even if you don't, you want to take what processes you do currently have and collect all the information you possibly can about who's coming to my agency and why are they coming. The other part we have is our able to work processes. So a lot of families that present to us still have the ability to work, and that's where they want to go and what they're trying to achieve. But the most important part when you're looking at your data is establishing what are you trying to achieve for your families? What are those outcomes? What are the desired outcomes you want for those families? Because when you're talking about necessarily unable to work families, typically what you're saying is that I'm trying to keep that family healthy and happy, and I'm not necessarily trying to move them up the economic mobility ladder. And it's a huge understanding to know that while we look at the demographic data and we look at the census data of all the people in our community, typically when folks are coming to our agency, this is where they register at, right? This is the needs that they present. So how do we collect that if we don't have a huge system? Well, I would jump right out here and say that I imagine everybody that runs a program has to collect some sort of financial information on each family we serve. So in that financial intake or the demographic intake that you take, you typically learn what is their form of income, right? And do they have the ability to earn additional income or not? So everybody has that information, and that's valuable. So if that's the only thing that you do currently, then that's the data you need to study. So if you look at it and you compare and you say on our census, it says that a majority of the families that we should be serving are able to work. And then you look at your agency data and you see that majority of the individuals that are presenting to your agency are necessarily unable to work. Maybe they're on Social Security, maybe they're on some other pension, maybe they're on some other form of retirement income at a very low rate, which qualifies them for that, then you would know. The other part is many of times, majority of our intake forms, have a birth date, or they have an age, or they have those type of things. And so you can really be able to analyze some of those families and what is their ultimate need, what is their ultimate desired outcome that you want to get them to. So that's some very, very basic data that we want to be able to collect and start to analyze and look at. The other part of data where it's at is what are the outcomes that we are setting for with our families, not for our families, but with our families. So we think about that on an ongoing basis, and we can think about the programs that we run. So even in very, very emergency service style programs, our desired outcome is to have a family that can't afford food, so they can afford their own food. We may have simple outcomes in childcare, right? That desired outcome may be that a family currently has young children and they don't have childcare options. And our simple outcome is that they have those childcare options filled. And making sure that they have those. Other outcomes that we really, really look at is, of course, around employment and education and income, right? The increased income. So those are the big outcomes that we're focusing in on and understanding how we set those. So that's important data that you already have, right? You know how many families are presented with what issues, and then how many families you've set those outcomes for. The last and sometimes the biggest, and what we have a mass amount of data, is the overall services that we offer. Now, a lot of times it's emergency services and what that information is, but it's also the other more intense services like employment programs, education programs, and housing. Now, I don't want this to be too much and say, well, we don't have a complete system, and that's not what we're going to talk about today. What we're really trying to focus in on is where do you have a system in a program that you may run? One of the pushbacks we get a lot of time is that we don't have a data system in place where we collect all this and we analyze that. That's not what we're talking about. It's very hard for most people to sit down and analyze all 100,000 people that they serve. That's not what we want to do. We want to take a small piece of the families that we serve, maybe one single program, maybe a portion of one program, where you're able to sit down and say, let me start with that, right? Let me start with the 50 people. Let me start with 100 people that I can sit down and understand who they are and what happened to them. And that's what we're going to talk about today. So we'll use one of those examples. One of the easiest ones that we all understand is jobs programs, right? Whether we have people that are unemployed and we're able to get them jobs. So this is a really basic one that I'll go through. And again, I'm going to leave us time to talk about some examples and some of the programs that you ran. So this may look very familiar. I know a lot of you are in the middle of your annual report time. So one of the biggest things that we have that we're going to go through is what we want to know is the percentage of participants in employment initiatives who get a job or become self-employed as measured by one of the following. Right, this looks very, very familiar. And on the left side here is the outcomes, and then on the right side is how we measure those outputs or those services that we give it. Again, this is very familiar. It probably looks more something like this into what you're submitting. So this is an annual report that you're already submitting. This is data that you already have. Two major things in those programs. So if you're reporting on a jobs program or an employment sector, the first thing you're going to have is the number of participants served in the program, or the term we like to use is the number of participants enrolled into a program. So if you have individuals coming into your agency and they present unemployed, able to work, as we mentioned, and they have a desire to get a job, then you may immediately classify that person as enrolled into attempting to get a job, or one of your subgrantees may say, this individual presented to us without employment, they are able to work, and so immediately our focus is how can we give them the opportunity to work and how can we give them the opportunity to earn income in their families. So this is how we establish we already have this collection. The second part is overall is a number of individuals that actually had results, right? That actually had that result. So if you look at 1.E is the number of unemployed adults who obtained employment, living wage or higher. So we all understand that. Number 1B, the number of unemployed adults who obtained employment up to a living wage. So when you have folks present, you say, okay, let me analyze this really quick. This individual presented to my agency. Doesn't matter for what service they presented for. At the end of the day, I know they came in, they did not have a job. They could possibly get a job because they are interested in the ability to work. And so I'm going to establish them as an enrolled person. And then you're going to have all this information no matter what program they presented for, right? You're going to have the demographics on them. You're going to understand what their income level is. You may begin to collect other information about all the needs and why they lack the access to be able to get a job now. So these are processes, these are information that you're collecting. Now, on the other side of the annual report that you already do, you may go over there and say what services you're providing to them. And then the other part of the annual report is you do report on those demographics of those people that you serve. So you have that information. And what we're talking about is analyzing. And so that's the next piece. And I always like this cartoon. It says, if I'd known they wanted me to use all this info, I would have never asked for it. So I'm hoping that at least made Jim Masters laugh. I know he understands that too. But that's what we're all talking about. We just had a conversation yesterday that a lot of times we collect all this information and then we supply the annual report, and we have a theory that this annual report information is so, that we meet the CSBG standard and so that we make sure that we report for CSBG. That's not always the case, right? What we're saying in this is an opportunity to take that information and actually use it to help better form your next community action plan. So the ultimate thing is, okay, I have data, now what? So the three things that we really want to be able to achieve that we feel like you want to be able to articulate before you write your community action plan is that you're able to interpret what the data says. You'll be able to organize it into a fashion where it makes sense, whether you're talking to your board, you're talking to other funders, you're talking to your staffs, you're talking to your elected officials, whoever it may be, is that it's in an organized way that you understand it, because you can't articulate out what we're going to say. And then be able to frame what it means. All the data that you have on the annual report doesn't really mean anything if it's just generalized agency-wide and says, well, this is just overall the outcomes and the outputs that we have, and we're just simply talking about how successful we are. We want to constantly be able to frame exactly what we're saying. And so ultimately, we're trying to get to an excellent standard. So one of the things we're going to talk about today It's a very simple, analysis techniques. And how do we do that? Again, this is a very, very, very simple process we're going to talk about that you can do before your community action plan. But typically what we're trying to do is attempt 4 things. Is the ability to be able to aggregate data across different platforms for a subset group of the families that you serve. Again, some of the things says that we count surveys, okay, or we count information, or we simply count and understand how many families we serve. But we want to be able to, give you the opportunity to talk about the ability to actually aggregate all that information together and put it together so that at the end of the day, when we're looking at it, one family is one family, and we're going to need that system to be able to really study and use this data of the families we serve to achieve the outcomes that we want. The other part is be able to compare. We're going to talk a little bit about that today. And then ultimately the goal is, after you're able to aggregate all that, count the information that you have, compare it, is that you're able to identify trends in your own local community based on actual information and data that you have. So that's going to be your goal. So I want to jump right in. I'm going to use one example that we kind of already briefly mentioned, and then really just jump into a little bit of talking about the process that I've used to be able to understand exactly what I mean. So first thing is, let's set up an example. So let's say we have an outcome target of families that we're serving in whatever program. We can call it the jobs program or whatever program we want to call, that our goal and our outcome target is that unemployed individuals obtain a job. Really pretty simple, probably something we've all seen before, maybe something we've worked with. And again, we have tons of targets all across our agencies. So let's say we run that program. And it involves, a collection of services, whether it's job training, maybe some childcare, some educational services. It might include transportation services, maybe some housing vouchers. So it doesn't matter. You have a collection of services that you offered, and you ran that program. You run the program and you enrolled 100 unemployed individuals. They presented to ABC agency and were given a set of services to obtain a job. So there was 100 families that came in that we said we're going to enroll into this program. And let's say you run the program for 6 months, 9 months, year and a half, and that 25 obtained a job. Well, typically what we report out is that 100 folks enrolled and that 25 obtained the job. There's my data. Oh, by the way, over here on the other module, I've claimed all these different services. But be able to really analyze and to understand what that means is that we have to analyze. So the first step in analyzing that, what we're trying to do and what we're trying to understand is, what is the difference, right? What is the difference in the 100 of the 100 folks? What is the difference in the 25 that attained a job and the 75 that didn't attain a job? And are we able to identify any of the trends? Again, we're not saying take the whole agency and do this. And if you have the power to do that for a lot of your programs, that's great. But if you don't necessarily do, again, just find one program, find one small subset of a program that you can do and be able to analyze that. So again, our target is to be able to understand what is the difference in the 25 that did obtain the job and the 75 that different. So the first data that I'm going to look at and analyze is the geographic and demographic differences. So is there a trend? Is there, out of the 25 that attained, was there an age trend? Was there a family size trend? Was there a family type trend? Was there an income level trend when they presented? All this information that I probably already collected on that intake form. So that's the first thing. The other part is a geographic difference. So if I served a large area, let's say I served my whole service area, did the 25 come from a certain geographic region? Was there more success around that? And I'm able to analyze that data, and that's going to be really important. One of the things that we were able to do in one of our Head Start centers is understand that families that came from a certain street were far less likely to be successful. Well, why is that important? Just simply having that information. Well, next year when we wrote our community action plan, we put in a subset of very specific services for that street because we knew that we could offer some different services. Now, what those were, we'll talk about those in a minute, how we came to that. But it's really powerful. At the end of the day, CSBG doesn't have enough money. We don't have to do the whole community if we have a plan and we have a reason for that plan. So simple geographic data was really, really important to us because we were able to install a local location for a couple of years to really focus in on one street. People say, wow, that's important. Well, at my last agency, we had 20,000 families in poverty in my service areas. 20,000 families, roughly about 72,000 people. This is only a town of roughly 220,000 people. So a high poverty percentage, not a very high poverty number comparatively to most of our communities here. On that street were 100 families. 100 families on this long street that lived in there. So over 300 people at least. Well, again, 100 out of 20,000 doesn't sound like a lot, but it's really concentrated and allowed us to concentrate our dollars to really start to move the needle by 1%. And so what we realized, that was extremely powerful for the next couple of years when we wrote a community action plan, just being able to analyze that data and say that if we offer additional services and heavily focus in on this street, we can actually have ability to make more change. Because again, we were already running these services, we were already running these programs, and they were still unsuccessful. So yeah, all these folks were getting a certain set of services, but they weren't really being able to get to the outcome that they needed to. So we need to reanalyze exactly how we helped with those families. So that's the first step when we talk about geographic and demographic. Any questions on geographic or demographic? Okay, I'll keep jumping in there. Maybe some more questions on the next step. So when we start talking about demographic, it really coincides with the needs that are present with each of the families that we serve and each of the families in these programs. So when I look at these 100 folks that we serve, one of the next things that I'm going to analyze and look at is what were the needs presented from each person. Again, this may not be a part of our overall collection process, but we can step back and analyze, again, a small subset of the families that we served in X amount of program that we're trying to reach and see what all the needs. Again, so if somebody comes in and this is an employment program that we're running, well, obviously they have a need for employment and we understand that. But if we can step back and look and say, when that person presented for a need of employment, what other did they present? Did they have their food needs met, right? We all understand that there's an idea that if I work, that I can go buy food. Well, realistically, it's very hard to go to a job when you're already hungry. So it doesn't matter how we go back and forth in that process. The question is when someone presented to our agency, what needs did they present with? Did they lack food? Did they lack the ability to purchase food? Did they lack housing? What was their housing situation like? And really just collecting the information or collecting the data on, is there a difference in their housing situation? Were they renters? Were they owners? Were they behind in rent? Were they behind in their mortgage? Understanding that data around housing and using scales to be able to measure that and put an understanding of that. Energy and utilities. When they presented, were they able to meet the needs previously with their energy and utilities at the time that they presented? And understanding that. Healthcare. Did they have options? Did they have the opportunity to get to healthcare when they presented? Same thing with the rest. Now you get into employment specifically. One of the things that we always look at is the two other major things to be employable, which is childcare and transportation. So did the 25 that were successful, did they present differently when they first got there than when they left, right? Typically, a lot of times that what we figured out is that many times the folks that presented and that were very, very successful had already had the means for their childcare. Well, that's really, really powerful when I'm writing my community action plan, that I just don't go over and say, I'm going to put this X amount of dollars in the employment programs and not ensure that I either do it through partnerships or ensure I'm going to do it with CSBG dollars, or we're going to have some other internal program that ensures that these folks need childcare. So that's really, really hard data to understand, to say, look, we ran a program for 100 people and we analyzed that information. We ran a program for 1,000 people and we picked 100 of them and analyzed the 25 that were successful and the 75 that weren't. Again, I'm not saying childcare is always the answer. I'm just saying that if that trend presents itself, that's a major difference between the 25 and the 75. That's something that should be, definitely considered as ability to change your plan. So again, you're looking at assessment in all areas, and you start creating a system to say, I'm just really looking at the gaps. One of the things I talk about all the time when looking at data, it's not necessarily rocket science as to what folks and what each one of us need to be able to achieve some of the successes. At the end of the day, most of us need childcare, transportation, housing, health. We need to be able to have the ability to access food and all those things so that we can realistically go and obtain a job. We said energy and utilities. We are going to add, and I want to make sure part of that discussion when you're analyzing data is the access to broadband or the access to telecommunications needs to be in that consideration too, because that may be a big red flag that comes out to you. And then you're able to go in and say, hey, this is something we need to invest in. This is something we need to research to understand, because this is a constant need that we're presenting and showing. Kind of give you a look at what it looks like just a visual look when we do this process for our agencies. Again, we would have our first assessment, which is this first column, which typically shows where folks were when they presented. And then the next step we would do is we'd look at and see, what services and the processes of giving them those services, but really where were they at when they actually left the program, and then being able to understand. But ultimately, in these assessments as well, is being able to understand and analyze what is the difference between the 25 that were successful versus the 75 or who not. A little off topic, but I always used to get aggravated when we had Head Start at my last agency, and we would have a classroom or a center with about 300 kids in it. We'd have parent meetings, and we'd schedule parent meetings, and about 20 families would show up. And I get frustrated with our staff because I'd say, what is the issue? And it says, well, we try to schedule the time with it that's best for the majority of our families, or for our families. And I said, okay, how did you establish what time was best for your families? And they said, well, we asked them. And I said, well, who did you ask? They said, the 20 people that showed up. And I said, okay. And they all decided that was the best time. They said, yeah. I said, well, what about the other 280 that didn't show up? What data, what information do we have on them? And I know that's talking about attaining or really, attending a meeting, but it's the same concept. We're always really good at being able to understand that we had 25 outcomes, or we put it out there, but are we really stopping and looking at our overall process to be able to analyze what that data is? And so we're going through this same process to ultimately be able to understand what is the difference in the 25 versus one of the difference in the 75. So I want to go back to this slide and talk about that. So if we have 25 that are very successful, and we look at how did they present? Then the next part is, what services did we give them? So out of those 25, if they either had their child care service met, and or we referred them, or we had that internal service of child care, and we were able to achieve that result in giving them the child care, and the other 75 also presented with no child care, but they did not receive that service, that may insinuate that that's a pretty important service to obtain our job, to obtain our outcome of obtaining a job. Right, that is actual data that you've been able to analyze and understand. And so in your community action plan, you're going to sit down and say, okay, well, we're not going to use CSBG dollars for childcare, but what we are going to do is use CSBG dollars to continue to become stronger in our partnership with our local Head Start and our other childcare agencies, because this referral process is going to mean a lot for us to get these outcomes. Same thing on the other side is you say, all right, well, we noticed that the 25 that were successful were either presented that their transportation needs were already met, or we provided a service that allowed them to get that transportation need met. And once they got that need met, then they were able to obtain an outcome. But the other 75, guess what? They didn't have that transportation need met. That's powerful information. That's really diving deep into analyzing. And again, we're not talking about sitting down and analyzing the agency as a whole. If you have the capacity to do that, then absolutely. We're talking about taking a small subset of some simple program that you have and be able to help you establish how you're going to run your program and why that is. Be able to have strong local data on what the gaps are in your community. So I just want to leave it with that. I do want to open up the floor. Again, this is just one example to really talk about other examples and programs that you guys run. So does anybody have different programs that they run that they have questions about, where there are possible gaps and possibilities for you to analyze data or data that you haven't yet? So any thoughts? Anything anybody wants to share? Oh, quiet bunch.
Hey, David, in the chat, Aubrey earlier had asked a question about the technologies that you use to do the analysis. Can you maybe explain a little bit more about, how you do that?
Yeah, how do you analyze it? So what did you know? So it's a lot of different things. The database that we had did not do that. What the databases I've always invested in did allow me to first and foremost establish a family as a family. So I want to make sure that makes sense. So when we were able to run reports and look at outcomes, the important part was that we were able to establish a family as a family and not as a unit of service. Does that make sense what I'm saying? Yeah, and you're aware of that. I know we've had these conversations before, but not as a unit of service. And so they're not a unit of receiving, food services, or not a unit of receiving housing service. A family is a family. So when we looked at databases, the data was able to establish that, and that was the most important thing. But then we go in and be able to add the additional simple Excel sheets of these are the services that they did receive. And the system in which we put in place to do that was to use scales. So if you're looking at a housing scale, we measured those all off, that were all 10 points. And then ultimately with those families that we decided that we were going to try to understand the difference, is we took that simple 10-point survey. Now that our system did allow us to do that, and it established a point value. And then we would, as we collected it, we would group the ones that had a certain value into different levels, and then see if there was a difference in the averages. If that's making sense what I'm saying. I'll say that again. So if we were using my example, the 2575, right? Obviously, we would collect each one of those 10 areas that we talked about, and I can go back to that slide. Oops, that one or this one. So each one of these areas would have a different scale. And so if we're looking at food, we did have this system in place in which we asked folks, where are you at on the scale? Are you able to, attain all the food that you could possibly want? Are you on, kind of SNAP benefits? Or are you on some other benefits that allow you to get food? Or are you just constantly hungry, or do you use a food bank? And so establishing where they were on that scale. And then we would compare and essentially, run an average and see if there was any huge outliers. The big thing that we did that made it a little simpler was using a number value. And I can show you that slide. I think I still have it. What I mean by number value, you can see here 5.57, 6.16. And then some of these other ones, when you look at like education, which was always really, really interesting, you can see that the education wasn't a valuable difference in the number when we looked at the two subset of groups, right? Because that's a misconception a lot of times, that, well, if we get people in education, they can obtain a job, right? It was, even when I was in WIA, it was always like, well, if we give everybody a job training program, they'll get a job. Well, that wasn't the significant difference for us, and so while we didn't want to stop the job training program, we found that we had to invest more dollars into these other resources because that's where the significant gaps were.
Yeah, that makes sense. Thanks for elaborating. I think we're new to looking at our data in this way. We've traditionally stuck with the kind of superficial agency report type data without doing the analysis. So there's a lot of opportunity, and it's kind of a new area. I guess to address your earlier question, since nobody else is saying anything, we're looking at, with our WIOA program, a real challenge with like recruiting participants. And I'm wondering if it would be helpful to see if there's like been any changes in the demographics of our clients over the years, and if that like will help us understand how our community is changing, or if there's some other reason we're not aware of that explains why we're having this challenge.
Yeah, that's a great example. So let's talk about that. WIOA, and you're saying you have a challenge recruiting, so you have a challenge enrolling. Is it a specific job training program, or just overall in WIOA getting people invested into saying, I want to start this WIOA process of obtaining a skill set and a job?
The latter. We try to set up like on the job training or work experience and training assistance. We're getting a little bit more applicants now, but we're still just not getting very much interest in the program at all.
So when you say the program itself, when that program currently is, if we're going to do an OJT program, or we're going to do, maybe a class somewhere, are the individuals enrolled able to select a broad range of careers that they would like to go into? I'm gonna get to my point in a minute.
We ask people if they want help, like getting training or finding a job. And then we work one-on-one with them to connect them with the relevant services. And we talk with the case manager, talks with them and sets up an individual employment plan. So we ask them like what they're interested in, but there isn't like a question in the application process that involves asking like what careers specific, like in general, they're interested in, if that answers your question.
Yeah, absolutely. So, all right, so to jump ships then, where I would look at, and what I'm looking at when I'm analyzing data and trying to mine the gap essentially with a community action plan at this point, if I knew that I was lacking enrollings in job programs, where I'm going to go over is to any other program that I run that involves people, which are most of them, but also involves people that are typically unemployed and unskilled at the time. And that's where I'm going to start diving into, is I'm going to understand whether maybe it's a Head Start program. And if you don't operate Head Start, maybe you partner with someone else that does. Maybe it's a food bank where folks come and some of those people are under or unemployed, or any other program that I run. And I'm going to start process immediately that says 2 questions we want to ask people when they show up is, are they able to work and are they interested in work? And when they don't, I'm going to start to analyze what that information is. And is that a subset? And maybe it's even a qualitative question where I start saying, is there a certain reason why you're not? And it's not attacking them that if it's just a personal choice, and that's a personal choice, fine for them. But if there's some other reason about it, maybe it's, I don't know about it, which is not usually the answer. Typically it's, well, I've got to focus on this and I have to focus on that. So what I'm trying to do is to mine what those gaps are to get people to it. An example would be, we have an immediate, jump to some of the very, very, very direct emergency service programs that we run. And you say, well, why aren't these people, excited about, a job training program? Well, they're trying to get over some mental health issues. So then I think about, okay, well, if that's a large population of the folks that I serve that qualify for this, then maybe I need to be really focused in on using other dollars or finding somebody else that does have those dollars to help some mental health aspects, even before I can, because ultimately you're trying to create a larger pool of folks to recruit from. So that's where I'm going to step away and try to analyze, not within WIO. I'm going to try to look at all my other programs, because those people are presenting underemployed or unemployed. Maybe that's an option, but a part of the process as well.
Yeah, those are interesting points. Thank you.
Yeah, and one of the things that I always love to say is that's the media CSBG, and you have the right and the ability to go into your CSBG plan and have that kind of narrative, that where you say we were lacking applications, or we know we've got the money for job training, but we can't even get people to that point. So where's finding that gap? And here's what we found. Here's what we found, between individuals we know that would benefit from that, but figuring out why they're not even, attempting to apply. Ms. Taylor, how are you?
I'm good. How about yourself today?
I'm great. Wonderful.
Good, good. I have a few questions. So thank you for this, the information. One of the questions that I have is about the 10-point survey that you have, and it's relevant to those identified needs areas. So is that identifying a point for each? Is this from the self-sufficiency matrix? Did you say that earlier, or is that along those lines of a self-sufficiency matrix, or did you create and build this yourself in terms of the point system, or it's not a point system, but the survey itself, how points are aggregated for a household? So I'm curious about that, and then I have other questions.
Yeah, it's built off the self-sufficiency, but if you mean create and build it, which means I stole it from Frederick Richmond and a system he built years ago, and then adapted it. One of the processes that I think is very, very valuable and we use on these 10 areas, and we used to have more and it got to be too much, is establishing within each area what that scale looks like.
Okay,
So if you're talking about a housing scale, the bottom or would be unhoused completely all the way up to can fully afford housing of choice, right?
right.
Deciding those in between is not a bad activity for staff,
Mhm.
to help establish what that means locally.
Mhm.
But honestly, we went through some of that and it's pretty universal, right? It's
Okay.
pretty universal as to, without being very specific, the family scale is, or excuse me, the food scale is completely don't have any food to food of choice, right? And everything in between you can kind of establish.
Right,
I'm more than happy to share that. Again, it's a, like I said, and all it came is 10 questions,
right,
10 questions that are guided along.
right,
And again, you can do that with a subset and then you just, the important part is once you ask the questions, you take it and say, is there one of these areas that are really shining out?
right. Okay.
And
And then I'll just ask one more question. When you're asking of the participants, are you able to work or are you interested in working? You're asking the participant to look at the whole household in response to that question? Or are you asking that individual before you? Sorry.
it's always a great question. So typically we identified if someone in the household was able to work
Okay,
as an able to work household.
okay,
And so because the idea was there's still the chance for them to be able to build income, right?
right, right,
Which is a different mechanism to our end result, to the happiness scale. So
right.
if no one in the household, if anyone is either self claim as no longer able to work,
Mhm.
then at the end of the day it's how do because we change what the gaps are, right?
Right,
So my thing is I immediately start shifting to, well, what is their energy consumption?
right,
And so maybe if a majority of my families that I served in my emergency food and were unable to work, then I'm immediately thinking about how do I lower their expenses?
right, right. Okay,
You know that, we talked about that before, but,
Yeah.
and so it's like, okay, if I have a mass amount of my population that are coming in as that, then my community action plan is going to talk about, based on this data, I'm going to focus heavily on more weatherization activities. And, I'm going to go after that program, or I'm going to partner with the local folks that do that. And I want to use some of my CSBG money to do that, because this is why it's important. It's important that I lower these bills because this is a mass amount of my population. And one of the things I'm glad you said is that's the key thing. There is a general understanding of data of demographics and who the families are in our communities. But you also constantly look at the people that we do serve, like who are the ones coming into my agency. And the old saying is we're trying to work ourselves out of business. It will never happen. But if I can lower some of the folks that are my biggest consumers, right, my biggest users that come 4 times a day or 4 times a year, then I'm able to reach out to new populations and create change.
right. Okay. Thank you.
Thanks for joining us, Deanna. And speaking with the service providers, a unique data issue that comes up in a service area as large as ours, it's a pretty good service area, Los Angeles County, is that there are several folks who are served at one time and may not return to the agency for more services. It makes it difficult to do trends. Any recommendations for those instances? Absolutely. So we're talking about once folks that come and we never hear from them again. The biggest thing is using what data you have. Don't try to create, you can't create data that's not there. So ultimately with it is to say, what are those trends of those people that come? And that's powerful data. So if 100,000 people are coming one time and they never come back, getting as much information as you can right when they show up. What is their education level? Do they have a high school diploma? Do they not? That's powerful. Hey, we had to see 100,000 people last year and 90,000 of them didn't have a high school diploma. Hell, I better do something around high school diplomas. I didn't be doing some GED stuff, right? And you're just putting that out there in the community, whether they take it or not is not necessarily, the key is always, I can't make everybody successful, but I don't want to be the reason why they're not successful, right? So I want to make sure the opportunities I'm provided So that's a great question, Stephanie. And so it's just collecting what information that you have. Yeah. The other part of that I would say is, and especially in a county your size and the way you guys operate, I would want to know if there's trends in the different sub-grantees that I have, being able to compare those. Are they seeing different people? What are the different results are? We used to, we had 17 locations. And you better believe we knew which agencies had, which locations had the best outcomes and which ones didn't. And then we took that next step to be able to analyze to say, was that a geographic issue? Is that because of the location and where it's at? And you know, I'm sure that's prominent in LA. Last thing I want to say too is, not last thing, but I want to make sure we discuss. Don't deny the information after you've studied it. A lot of people will really do that. They'll say, well, we're not 100% sure. Neither is anybody. If anybody was 100% sure of the answer of poverty, if we had enough money, we would have done it by now. But you are sure enough based on the information that you have. And we've got to be bold in those decisions to say, this is what we're going to be able to do. And other questions? I saw some more folks come on. Now to be questions, conversations about programs you run.
Okay, my turn.
Yeah. Well,
Hey,
Wilmer, it says Leslie, but it's Wilmer. Okay, nice.
really? It says Leslie?
Yeah.
Leslie's not having a good hair day today now. Okay. One of the things that we see in the annual reports continually, and it's kind of disturbing, well, very disturbing, is that in the client characteristics area, there are a lot of unknowns. And if you have a lot of unknowns, you have no idea who you're serving or what their needs are. So what are some techniques to decrease that number of unknowns?
Yeah, it was always a big issue. If you talk about emergency food, if you talk about, if you run we had a major transportation program that it would run, it was always hard to gather that information. One of the things is you're looking back at, and I pulled the slides down, but looking back at the system in which you operate and how you qualify folks to be able to get the services that you have. And what I mean by that is backing up the process to where you say, we are going to run this emergency food. We are going to run this transportation program. Again, we're not going to hand everybody a card and say, give me your demographic data to use that. But a lot of that is around communication of why we're trying to have that information about who people are, especially if it's a large portion. And, you know, it's backing up the process to the very beginning to say, okay, no matter which way you come into our agency, our goal is to understand who you are so that we can make sure and offer you additional services. That was the key for us. And to also change processes to say, it's okay to ask people. You know, it's okay to ask to say, you know, this is the reason why we're trying to get this information so that we can see if there's anything else that we can offer you while you're part of us. But one of the silos that has to break down is that this is a food program or this is a transportation program. No, we're a community action agency. And so I think that is a cultural shift that you have to have, and you have to understand it's still not going to be all. But yeah, that was always my biggest concern as to why there were so many unknowns, you know, like, and it is changing a little bit by little. And especially, yeah, this could be difficult depending on what your system is. I'd want to know exactly why are those unknown. You know, we had some programs that there's no way it should ever be unknown, like a Head Start program. And I'm like, that should not be unknown. That should not be unknown. How are they in this class? That answer is unknown. But, you know, again, some of the transportation, it was, you know, backing up and trying to change the original intake process. If that makes sense. Because one of the things I preach on data that's so important, the more you do at the very, very beginning, the easier it is on the backside. But you have to establish that process now. I mean, if you're really talking about processes, we're in February, you need to be looking at what is that process change going to be for 2024 so I can have more data. And then when you do your plan in 2025, you're better off.
What would you say to agencies that continually say, you know what, this is like, oh, this is tough, man. This is like all this stuff, all the stuff that we do. And then you want us to do all this stuff with the data. I mean, like, man, we got people to serve. What do you say to an agency like that?
Yeah, start as small as you need to. You know, to me, it's like anything that's new, anything that we try. Because there's two reasons why. I mean, nobody gets up and runs a marathon on their first step.
Right.
So even if it's 10 folks, even if you got sub-grantees and you say, hey, our sub-grantees are not going to be, if you can find one of them that is willing to engage and to understand that. And the second part is, I'll tell my story. I took over an agency in Arkansas, Mississippi that was failing and about to go down. And it got really, really tiny. We had to lay everybody off. We got down to 10 employees. And we shifted. It was a little easier because we only had 10 employees. So it was easier to encourage the other 9 that stayed with me to change their mind. And what that allowed us to do is we tripled in size as far as financially. And when I left, we had 120 employees. And the reason we were able to do that is because very, very specifically, we were able to say exactly what our families need. And so when you talk about getting time back, there's nothing more frustrating than writing a grant or asking people for money and not getting it. That was a majority of our wasted time. And a lot of that was because we didn't have the information correct. We talked in generals. So we would say, well, people need help. That doesn't mean anything in the funding world. You know, everybody thinks somebody needs help. But when you're able to go in and articulate and say, well, based on our data, our families are between the ages of 18 and 24, they're single moms, they have a high school diploma, they don't have anything else, they have 2.5 kids, and this is what childcare costs. And when our folks are trying to go to work to do this, this is exactly what's happening. This is what I need money for. That's where it happened. And so as the money starts piling in from that sense, because I had that information, because it was more accurate. And the beautiful thing to me about CSBG, if you analyze or you don't analyze and you run a program and it doesn't work out, they don't ask for the money back. They never have. I know you don't want me to say, I've been doing this 15 years and 50 years, as long as you didn't steal it, now you steal it, they want the money back. But if you try your best and you try to run a program and it doesn't work, it don't matter. It is
There's no risk. There's very little risk.
It is the best way to try things out, to try to understand. But if you're just trying things out because you like to do it, if I got to try things out because I like to do it, we'd spend money on better baseball stadiums because that's what I like to do. But they don't do us any good. So the thought is you, using the baseball analogy, you just got to get in the back box, swing a couple times, and then you learn more and more every time. And that's the key. And again, don't try to make it more complicated, but what you're trying to do is get out of the gray area, because we operate in way too many. People need help. We need to do more things. That doesn't, those words tell me nothing, you know, like, and the key is, especially in our state, there are people looking to fund very specific. So I don't mean to remote. We do this in our state a lot. So, oh, we need to do something about homeless. First of all, it's kind of defensive or aggressive term to use, but that don't mean anything. It's just a word that people want to jump on. But when you are able to analyze and say, okay, well, we did a point in time count, right? And we have, 5,000 people that are unhoused. And this is exactly who they are, and this is exactly what they need. It's a different story.
Different story.
And then you hire us to play the politics when they don't want to fund it for you. That's where we come in. That's our point. So the short answer is start as small as you need to. I don't care if you got to go all the way down to 10. Just start tiny. And then it also gives you an opportunity to find somebody on your staff that can do that, have that skill set, and to have that understanding.
Yeah. Oh, okay. I've stolen her identity. Now I gotta leave. So, who is the real Leslie Taylor here?
Nice. That's good. That's good.
Well, a great conversation, because I think one of the areas where I think a lot of our agencies really cheat themselves is the ability to kind of take a look at what they've collected, to evaluate it. Who are we serving? What are we doing? What do we really intend to do? And kind of get that story. You know, it's a powerful thing. What's kind of for us in the state view, you know, I want to talk with agencies. I love to get into conversations when they're collecting agencies in order that they may serve the people that they're serving in a greater way, that really understand the list of needs versus just kind of putting together some numbers and throwing it at the state. I mean, there's no fun in that. There's no fun in that. The fun comes in when we can take that data, chop it up, analyze it. Who are we serving? What are we doing? You know, what can we do better here? And the data gives you that information, and it really leads to a fuller penetration into your communities and your service context. So, yeah, I love those conversations.
Well, and I'll throw another one out at you. Sometimes folks say, well, you know, we don't have the processes in place to collect data. I said, okay, I use a program that I've run in every agency, which is LIHEAP. We're a lot of us are familiar with LIHEAP. It's an emergency service program as you get, even though it shouldn't be. Well, one of the things that was able to make us successful in fundraising was we would go in and say, the LIHEAP families that we served, how many were able to work or working, how many were unable to work, and, you know, on a fixed income. And people say, well, how did you collect that information? Well, how did you qualify them to get LIHEAP? You got their income information.
Exactly.
You had to get that. So you already have it. So it's thinking, okay, so then it is putting a system in place. So I don't even care. We started with a piece of paper on the desk, and you would take a tally mark and say, working,
Right.
not working, working, unable to work. Real simple. And then it went into Excel, and then it went into, okay, well, the system will automatically read that if I put in that your income is Social Security versus I put in your employment income, right? You take that information, you're able to analyze just those simple facts that I have is to be able to go out and then to understand where they're at. So when I go in the community and say, this many people are able to come to your job every day because they get energy assistance. It's not about keeping the lights on, right? It's about keeping the community running while pay is too low or whatever it may be. Now we can argue that different with them, but that simple fact and being able to understand. Now, if you add something else to say, okay, how many people with energy assistance come in that have kids? That's powerful to understand. And one of the things that it allows us to do in the conversation is when you develop your programs, very few people come to get emergency services because something happened in their life. What's happening in their life, they don't have enough income to overcome challenges. It's nothing else than that. We create all this other idea that, oh, my car broke down, this, all that. That's not it. That's not it. It's that you don't have the income means to live life. And it's tough. So if we understand that establishment, it's like, okay, so what are the areas, you know, that I can help you improve going forward? And so that's the data I'm looking for, because that's what my CSG plan's about. My work plan's about how can I write things for going forward? So that's the conversation. Lawrence, are we over time? It's supposed to be an hour. Okay, well, I apologize. That is not supposed to happen. That is rule number 1 in Lawrence Heiner's book is don't keep people longer than you told them anyway.
And get feedback for your session. So there is a link in the chat here. Speaking about data collection. So that'll be my 2 cents. Please tell us how we did. Thanks, David.
Yeah. All right. Well, if there's any other follow-up, any questions, anytime you guys are doing this process, please reach out to us. We can look at what data you have. Again, it's about not creating new data at this point. It's just using what you got to really tell your story and really to be able to tell what your plan is. So thank you all very much. Thanks for your time. Look forward to it.
Right. Thanks, David. Good job.
Thanks, guys.